I want to thank you for allowing me a second opportunity to talk to this group. I appreciate it. My husband was going to join me later, but
do you want us to wait?
No, that's okay. He'll appreciate it if we don't. Our daughter has had significant challenges with anxiety and depression and issues around her adoption. We adopted her when she was, just a couple of days old at the hospital. So our family has had direct experience of the behavioral health system for over 10 years, as we've sought help for our daughter since she was about 6 years old. She just turned 18 recently. I specifically want to share today some challenges around our experience with the insurance company covering the most effective therapy that she received during this whole long journey towards self-sufficiency, and that is wilderness therapy. She participated in a Durango-based wilderness therapy program for 10 weeks. This was not a boot camp kind of experience, but it was a remarkable, powerful two-generation approach that used yoga, mindfulness, working with licensed counselors to learn to communicate her feelings more effectively. It helped her so much. Blue Cross Blue Shield, our insurance company, which we value so much, refused to cover wilderness therapy. It's just blanketly said that wilderness therapy is not covered. But we, of course, didn't accept that. So we appealed the denial of coverage, and they, of course, turned us down. They denied our appeal the first time around. And with the assistance of professional help, there is a company that helps you manage your denials called Denials Management. We appealed a second time, second level appeal, and after 18 months of what can only be considered as a forensic insurance investigation with the help of that company, did they cover us at an out-of-network rate. It was really, barely break even between what we paid out of pocket and what we paid for the assistance to help appeal. But I just want to say that wilderness therapy has mountains of evidence. They've been tracking their success on individual children and adolescents and young adults for a decade now. And there are mountains of evidence that it really is effective. She worked with licensed professional counselors that were on staff, and I really don't think that it should just be not accepted. It reminds me of the occupational therapy, little loopholes that we heard about from others earlier. But wilderness therapy is a very effective treatment for hundreds and hundreds of children, and I would like for you guys to put it on your list of things to look at that really should be covered. Our experience as a family with that program, because they use such a powerful two-generation approach, they required us as both parents to communicate back and forth with our student, not only in letters, where we would send our letters to the therapist, and she would redline them and send them back to us electronically, and so that we would be taught over and over again through this 10-week period how to better communicate with our daughter in ways that were effective and powerful for her. It was really effective. So I want to switch gears also and give another plug for the book that you suggested that everybody read, which is the epidemic. What's the name of it again? Anatomy of an Epidemic. Sorry, a little nerve-wracking up here. Anatomy of an Epidemic, and the help of others in the community here helped us get our daughter to start weaning off of the meds that she was on. And I know I mentioned that the last time I testified. But it's amazing how much better she's gotten just in these last few months, taking less meds. And, you know, we thought she would be on meds for her whole life. Once they tell you that you need them, they don't say that maybe the meds could be causing you problems. But I just want to thank you for taking the time to be here. I want to thank the rest of the community for being so supportive of all of those of us who have kids that have been through the challenges of getting help for anxiety and depression. It's not easy, and it's really important to have the support of your neighbors. Thank you.
Thank you.